So I want to talk about cryotherapy. And I'm not talking about wrapping an ice pack around your leg. And I get there's a lot of sources out there that talk about this all the time, but for someone in my shape and those of you in a similar situation who have severe chronic pain, degenerative issues, potentially Ehlers-Danlos or something similar to that, tools like cryotherapy can be so much bigger than what we really understand. And I think that there's an underwhelmingly sad use of such a great tool. So cryotherapy, specifically the one I'm talking about, is ice machines. Essentially, it is a cooler with ice and water that circulates cold water through a pad that you can wrap around different joints. They make them for the knee, they make them for the shoulder, they make them for the spine, they make them universal in size. There's various sizes, and I'll show a depiction on screen of all these for you to see. There's various different types of these cold therapy machines on the market. They seem to average a couple $100 per machine, so they're not crazy cheap, but they're not crazy expensive. And after a lot of surgeries, a lot of doctors will prescribe these things to help you heal, because some of the best science of cryotherapy is actually within its ability to help someone recover post-surgical interventions. But it helps immensely on a variety of other paths. As I've mentioned in many videos, I'm in my 40s. I've been told by many doctors I should already be in a wheelchair. I'm not. The reason I'm not is through all the different amazing protocols that I've created for myself, and one of which is cryotherapy. And the machine is really important. So when you put an ice pack around your knee, you're chilling an area in an inconsistent temperatured way, which can be beneficial, but you can't get maximum benefit. When you use an ice machine, it keeps consistent temperature for a full duration that you're gonna need. In particular, with cold therapy, the general consensus and the science shows 15 to 20 minute sessions at about 50 to 60 degrees of temperature being circulated in an area and once an hour at max can give you some benefits to pain, inflammatory limitation or mitigation and such. So how it works is through the cold treatment is vasodilation. Vasoconstriction. So when you put a cold therapy treatment on a part of your body, it reduces the blood vessels flowing to that spot and reduces essentially all blood constriction. So it causes anti-inflammatory effect, and it lets the body, the blood slow down, and to a degree let a beginning healing process start through a numbing, essentially. But it's not just the vasoconstriction, it's also numbing of the nerve agents, which is what people get the actual pain relief from. What people don't often know is it's just as important the following phase, which is vasodilation, where you take the ice off and the blood vessels expand, fresh blood and nutrients refill the area, and it's basically causing almost like a pause and a filter and a refreshing of the blood vessels in a zone on your body, thus leading to progressed healing states. So it helps some with pain through by dulling nerves due to the cold treatment. And then through how it handles blood vessels, it can help the joint become non-inflamed, less red, less blood vessels in a spot, and then also get a fresh set of blood vessels with fresh nutrients after. So there's amazing science behind this. It's been being prescribed more and more. It's not new science, but it's amazing how many people that I've met that don't use it at all. They think an ice pack works. I can't tell you how often I'll speak to people almost every day. Someone asks me about an injury nowadays constantly, and I'll ask about icing, rest, elevation, all the rules for recovery from an injury, and people still have the old let's grab a bag of frozen peas mindset. And I get it. If that's what you have to do, that's what you have to do. And if you can't afford a $200 machine, I get that as well. The next best thing is a frozen bag of peas or anything frozen that you can put on a joint. But there is great science to this, and it's not what people think though. It's not a one and done thing. It's a commitment thing. So for example, for you guys, when I did my first trip of delivery of products from Arizona to Wisconsin during our move, I brought an ice therapy machine with me, and I cycled on my knee and my shoulders and my back at different times throughout the drive, and it gave me amazing relief and like little breaks of from the pain during the drive, even though the core issue wasn't being helped, because when you're driving long distances like that, you're creating compression, you're creating some issues that are going to be a problem later. But it absolutely mitigated the feelings and numbed the senses and nerves of those areas, so the pain wasn't as strong during the trip. And then as far as recovery from issues, even afterwards, you know, if you have the time, and I pray that you do, but if you're suffering from things that bad, you probably do have the time, whether you want to or not. But lay down, cycle ice therapy on your leg for 15 to 20 minutes, once an hour for several hours. Elevate your leg, which also restricts and controls blood flow to that in particular joint, whether it's your knee, shoulder. That's a big rule of thumb with all this stuff too, is elevation, because you want to slow the blood vessel progress through that joint. That's one of the ways of causing an anti-inflammatory environment. It calms the cytokine storms that can infect an area as well. So there's a lot of reasons to do it. But cryotherapy, a super helpful tool. I really think you should use it. This is one of many videos that we're gonna have on each different thing that I do and use to help keep me moving and to make sure that what all those doctors have said will not come true. I refuse to let myself be in a wheelchair. I refuse to make myself to walk with a cane. And if you're getting the same information, you can avoid this stuff too. So follow along and we'll keep talking about more stuff.